Hello, I am Mohit Yadav. Can I know your name and age?
My name is Tejpal Yadav. My age is 25 years old.
Okay, Tejpal. So now I'm going to take examine of your cardiovascular system. Is it okay?
Okay.
Thank you.
General appearance of the patient provides many clues to cardiac illness. Observe and note the patient's color, respiratory rate, and level of anxiety. Measure the blood pressure and heart rate. For heart rate, palpate the radial pulse using the pads of your index and middle fingers. To estimate the jugular venous pressure, make the patient comfortable. Raise the head slightly on a pillow to relax the sternomastoid muscles. Examine both the sides of the neck, then turn the patient's head to the left since the physical examination is conducted from the patient's right side. Look for the oscillation points along sternomastoid muscle between the clavicle and the angle of jaw. Identify the highest point of pulsation in the right interjugular vein. Extend a long rectangular object or cord horizontally from this point and a centimeter ruler vertically from external angle, making an exact right angle. Measure the vertical distance in centimeter above the external angle where the horizontal object crosses the ruler. Next, examine the carotid pulse. Carotid pulse provide a valuable information about cardiac function, especially aortic wall, stenosis, and regurgitation. Inspect the right and left carotid artery. Avoid pressing both carotid artery once. This may decrease the blood flow to the brain and induce syncope. Your assessment includes palpation to assess the amplitude and counter of carotid upstroke and oscillation for presence or absence of thrills and bruises from turbulent blood flow. For oscillation, also patient to stop breathing for a moment. Then listen from diaphragm of stethoscope. Cardiac examination, stand at patient's right side. Patient should be supine raised up to 30 degrees. Inspect the anterior chest, noting any hips or lifts. Careful examination can also reveal the location of apical impulse. Proceed the general palpation of the chest wall. First palpate for hips or lifts using your finger pads, holding them flat. Then check for thrills, processing the ball of your hand firmly on chest in the same location. To identify the apical impulse, ask the patient to roll partially on left side into left lateral decubitus position. Palpate using palmar surface of the hand. Once you find a apical impulse, make finer assessment with your fingertips and then with one finger. Once you find a apical impulse, make finer assessment with your fingertips and then with one finger. Note the location, diameter, amplitude, and duration of apical impulse. Ask the patient to exhale and briefly stop breathing. Then place the tips of the curved fingers in the left, third, fourth, and fifth interspace to palpate for the systolic impulse of the right ventricular. Then palpate the right ventricular in the epigastric or subxiphoid area. Osculation of heart sounds and murmur is a preeminent skill where it leads directly to important clinical diagnosis. Start at either the base or open concentrate on each of the events in the cardiac cycle, listening carefully to the S1 then S2, then other sounds and murmurs occurring in systole and diastole. To detect mitral stenosis, ask the patient to roll into the left lateral decubitus position, which brings the left ventricular closer to the chest wall. Place the bell of the stethoscope lightly on the apical impulse and listen carefully. To detect aortic regurgitation, ask the patient to sit up, lean forward, exhale completely and briefly. Stop breathing after expiration. Press the diaphragm of the stethoscope on the chest, listen along the left sternal border and at the open, pausing periodically so the patient may breathe.